Um, Hello everyone, sorry for the delay. We've been waiting for people to join in. Let's get started. First of all, good morning, good afternoon, and good evening to all of you. We have people joining in from different parts of the world, so I'm trying to be time zone inclusive. Greetings to all of you. I'm Saili Mure, a member of Jnana Prabodhini Foundation's iBRETA project, and I'm thrilled to have all of you here for the fourth session of Health Katta series. First, let me begin by introducing Jnana Prabodhini Foundation, or JPF for short. JPF was founded in 2019 when a handful of Jnana Prabodhini alumni and associates who have been settled and studying abroad came together with a dream of giving back to the country. With multiple brainstorming sessions, JPF was born. JPF is a 501c3 nonprofit organization registered in the US. It has views aligned with the same values as its parent organization, Jnana Prabodhini. JPF focuses its work in mainly three areas: rural development, education, women leadership, and empowerment. JPF, in its past 3.5 years, has conducted numerous different activities in these areas and has undertaken multiple projects. Currently, we have over 750 individuals from 12 regional chapters spread across US, Europe, and India, and more than 200 volunteers who have joined this mission and vision. Among the multiple interesting projects that JPF has, iBRETA is one of them. iBRETA is short for Initiative for Research, Education, Training, and Awareness. iBRETA aims to bridge the gap between research and medical experts and the general public by providing a platform to encourage communication and collaboration between the two. As the name suggests, iBRETA covers 4 aspects. The research aspect. Under the research aspect, iBRETA aims to develop research aptitude among young biological researchers. With education aspect, we want to induce scientific acumen of students by providing them with a skill-based approach for approaching science questions. Under training, we want to become a tool for people to seek expert guidance and training for managing important issues in public health. And with awareness aspect, we aim to become a bridge for enhancing communication between medical communities, field experts, and the general public to provide authentic scientific information about health and diseases. Today's session in Health Katta series is a part of this awareness aspect. Previously, we have conducted multiple sessions in iBRETA Health Katta series. We have had the pleasure of hosting multiple great speakers such as Dr. Milind Vatve, Dr. Prayag Sethia, and Dr. Vanita Patwardhan. And our latest talk was by Dr. Yogesh Shoche. So today, for the 4th session of Health Katta, iBRETA is honored to have Dr. Udayan Apte, who's popularly known as the liver guy in his department, to talk to us about liver and its moves. Dr. Apte is a toxicologist and a liver pathobiologist at the University of Kansas in the US. His research focuses on liver regeneration, drug-induced liver injury, pathogenesis of liver cancer, and the effects of perfluorinated chemicals on liver. He is a diplomat of American Board of Toxicology and a board-certified toxicologist, a member of the US EPA Scientific Advisory Committee on Chemicals, and he is a 2022-2023 president of Central State Regional Chapter for Society of Toxicology, USA. Dr. Apte is also actively involved in mentoring young researchers and has a deep interest in empowering research in India. Dr. Apte, we are excited to have you on Health Katta and really eager to listen to today's talk. So with any further ado, let's welcome Dr. Udayan Apte.
Thank you. Share my slides. All right, can you see my slides? Okay. All right. So first of all, thank you all for inviting me to give talk about what I really am excited to do all the time, and that is liver and its moods. So I'm just gonna give you guys a very general overview of what the liver does, and when it is in a good shape, what happens when it is in bad shape, and some of the ugly things that can happen to it in terms of liver diseases. And I'm going to keep it a very short and simple so we can have more discussion at the end. All right. So liver is for me, liver is probably the most important organ in the body because I have been studying it for a long period of time. Generally, I'm a basic scientist, and we use a lot of mouse models in the lab. And I tell my students that when I see a mouse, I really see a big liver with a tail. So that's how hepatocentric I am, focused at the liver. And I'm fascinated by it because it does a lot of very interesting things. It is a main metabolic organ in the body. And if you think about what all it does, its functions can be put into three categories: synthesis, storage, and distribution. So it has this ability to synthesize different things. One of them is bile. Bile is a very important component of our digestive system. Also, bile acids are very important for a lot of other health and disease aspects. And so the bile is exclusively synthesized in the liver. The other thing the liver is very important for is drug metabolism. We get exposed to hundreds of different chemicals on daily basis, and all these chemicals need to be removed from the body. And those chemicals eventually will reach liver, and we'll talk about that here in a minute. But liver has these special enzymes that can take care of these chemicals. They will either make them fat soluble or water soluble and then excrete them out of the body. Liver is a micronutrient metabolism hub. It is involved in absorption and distribution of fat. That's where its storage and distribution function comes in. It stores glycogen. When we have glucose in our food, extra glucose is converted into glycogen. And there are two organs where it is stored. One is liver, and other is the muscle. And when you exercise, you basically use up your muscle glycogen first, and then you start using your liver glycogen. So it's one of the important parts of parts of our metabolic process. And when this doesn't work, you can get diabetes. So glycogen storage is an important part. Another one very important function that liver does is production of urea. As you probably know, there are lipids and carbohydrates and proteins in the body, and nucleic acids and vitamins. But the muscles are made up of essentially amino acids or proteins. And when they are recycled, you generate a lot of nitrogenous waste in the body. And that nitrogenous waste is essentially converted to urea, which is then excreted as urine. And so urea production is exclusively happening in the liver as well. There are other many things that we generally don't really associate with liver. For example, liver makes coagulation factors. Our blood, when we get injured or have a wound, the blood will coagulate, and that is very important for our health and safety. It requires certain proteins that are called as coagulation factors, and they are exclusively synthesized again in the liver. So when liver fails, your ability to coagulate your blood goes down, and so these patients of liver disease are at a high risk of bleeding. And so you wouldn't associate liver with bleeding, but it is directly associated with that. So if you think about all of this together, you will know that having a healthy liver is an extremely important part of our life. So where is the liver? Well, liver is present. It's a visceral organ. It's present right below the diaphragm. As you can see here, it is just below the diaphragm, under your chest in the visceral cavity. It is essentially tucked in at the wall of your diaphragm, and it is well protected from the top by the diaphragm and the rib cage, and it's generally on your right side of your body. So if you think about it, the midline of the body, left side is your stomach, but right side is where the liver is. So any pain in the right side of upper right side of your body could be related to liver. to liver, just so you know. And it is a part of the entire gastrointestinal system. Generally, if you think about a liver doctor, they start out as GI doctors or gastroenterologists, and then they become specialized in the liver. So because liver is very intimately associated with the gastrointestinal system. Part of the liver is gallbladder in a way. Not all animals have gallbladder. For example, mice have gallbladder, but the rats don't have gallbladder. Humans do have a gallbladder, and you might have heard about it because gallbladder removal surgery is very common. A lot of people get gallstones, so that people know about gallbladder. It is a pouch that is attached to liver with the cystic duct, and that's where all the bile that liver makes is secreted and is stored. And when we eat something, the bile is then empties that gallbladder. Bile actually comes out of the gallbladder into the intestine and helps with digestion. This is how a human liver looks. It has essentially 4 lobes: left, right, caudate, and quadrate. If you think about your right side of your body, the left lobe is the small lobe, this one right here, that goes towards the left hand of your body. And this is the big right lobe, which is the larger part of the lobe, which is on your right side of the body. If you flip it, you will see there are 2 small lobes, caudate lobe and quadrate lobe. And at the base of this injunction is called a falciform ligament, where all sorts of blood vessels go in the liver, and the gallbladders or the bile duct comes out of the liver. So this is how the liver looks. It's a pretty big organ, generally about 5% of your body weight. So if you weigh 100 kilograms, 5 kilograms of that is your liver. So it is a pretty prominent organ in the body. What are the unique things? There are several unique things about liver. One of them is the blood supply. Now, you might know that almost all organs in the body, not almost all organs in the body, get 2 blood supplies, right? There is fresh blood that comes from the heart. When we breathe, the oxygen gets into the blood in the lungs, and that blood comes to the heart. And heart is a big pump. It pumps the blood and supplies that oxygen through the blood to all the organs. So all organs get this arterial blood supply, or the fresh blood supply. And then when the cells in these organs use the oxygen, the deoxygenated blood is collected from the organs into what's called as veins, and that goes back to the heart where it is pumped back to the lung for oxygenation. So all organs have these 2 supplies. In case of liver, it actually gets 3 blood supplies. It's a unique thing. What happens is liver gets its fresh blood supply through hepatic artery, which comes from the heart. But this same hepatic artery is a branch of the major aorta, and this branch provides blood supply, fresh blood supply, to all the other gastrointestinal tract, which includes everything from your esophagus to colon to rectum, small intestine, pancreas, spleen, stomach. Everything gets supplied with fresh oxygenated blood. Now, all the blood from these organs, after it is deoxygenated, that means the oxygen is used, is going back to the heart, but it doesn't go back to the heart directly. It stops by the liver. So liver has this extra supply called as hepatic portal vein, which brings all the venous blood supply from the gastrointestinal tract and dumps it into the liver. Now remember, this blood doesn't have any oxygen, but it has something else. It has all the nutrients. So whatever you eat will be absorbed in your stomach, in your intestine, and that will be secreted in this portal blood, which first stops by the liver. And that's why liver sees all these highly richly nutrient-dense materials right after you eat. So if you ate a huge meal just before this talk, during this talk, your liver is seeing all that meal in the molecular form, and it's going to your liver. And then, of course, when the liver cells use the oxygen and do whatever they need to do with these micronutrients, it will throw out all the deoxygenated blood into hepatic veins, which will go back to the heart. And so this kind of the plumbing of liver is very unique, and that's why it plays an important role. Now you think about it, because anything that you eat will go to the liver rapidly. rapidly. That also means anything that you will eat through your water, any chemicals, any viruses, any bacteria, anything that is bad as well will end up in the liver. Anything that is good will also end up in the liver. So that is a critical thing to remember. Each organ has what's called as a functional unit, right? So the functional unit of a brain would be something like a neuron. A functional unit of your kidney would be something like a nephron. In case of liver, we call it liver lobule. And I know this is very technical, so I'm not going to take too much time over it. But what I want to tell you is this picture in the middle here is a slide, a section of a normal liver. And it has two ends if you think about it. There is this large structure called as portal triad. Now, triad means three things. Okay, there are three different vessels that come together. And these three vessels include the hepatic portal vein, which brings blood from the gastrointestinal tract or the gut. It also has the hepatic artery, branch of hepatic artery, which brings the fresh blood from the heart. And it also has this bile duct, which essentially takes the bile out of the liver at the same time, right? And then blood that comes from the artery and the vein, it flows down these lanes to a vein called as hepatic vein, central vein or hepatic vein. Between these, what we have is cords of hepatocytes. Now, I want you to imagine something like a city block or a area in your city where you live. What you have is rows of houses, and behind and front of it are roads, right? These roads are essentially what's called as hepatic sinusoids. Liver structure is similar to that. You have a big road, and then you get into your neighborhood, and there are rows of houses, and between them you have these roads. That's exactly what happens in the liver. Traffic flows through these roads. Similar to that, blood flows through these sinusoids and goes to other big road where it can empty out of the neighborhood. Now, bile flows in the opposite direction. Bile flows from the central vein area back, and think about bile as the drainage system in your neighborhood. You know, the drainage is coming down below the houses and it's moving in one direction depending on the slope of the land. And this, in this case, all the bile is actually secreted in the opposite direction of the blood into the gallbladder. Based on this basic structure that blood comes here, flows down and goes out, and bile flows in this direction, liver is divided, or liver lobule is divided into three zones. Zone 1, that is the cells that are right close to the portal triad. Zone 3 is cells that are close to the central vein, and zone 2 are the cells that in the middle. Now, if you look at the picture, you can't tell them apart. They are very similar to each other. On a section of a liver, they look exactly similar. But if you do some high-end genetics, you'll find out that each of these cells, they are actually very different because they do different functions. And this is another way of looking at it. This is just a cartoon showing the same thing. You got these three vessels here. This is your portal triad. Blood comes from the gut or the heart, and the bile is going out. And then you have blood that flows through these sinusoids or those roads in the liver to this big road, and it is going to the heart. Then these cells here are zone 1, zone 2, and zone 3. One of the major things that is different here is the oxygen concentration. Now, remember, blood that comes from the heart is highly oxygenated, right? So the blood that comes here on the portal triad end has a lot more oxygen. And as it flows down the liver lobule, it loses its oxygen because it's donating it to the hepatocytes. By the end here, this blood is purely deoxygenated. So oxygen concentration in the liver kind of decreases. And a lot of people think that that kind of drives what the liver does. For example, cells in zone 1, they metabolize fat. They also make new glucose when needed. Suppose your glucose is too low and you have fat, they can convert that fat into glucose. That's called gluconeogenesis. The cells in zone 3 do opposite things. They actually make new fat and they metabolize glucose. They cannot make glucose, they metabolize glucose, and they can make new fat from other things. Triglycerides and lipids are synthesized in this part. So the metabolic functions are kind of zonated. What do the zone 2 cells do? For the longest period of time, we didn't know what they did. But about 2 years ago, a colleague of mine published an amazing paper in Science, and they showed that these zone 2 cells are the cells required for liver regeneration. We're going to talk a lot about liver regeneration here in a minute. Liver has this enormous capacity to regenerate itself. And it turns out that cells in this zone are most important for regeneration. What are these cells? Well, I'm not going to go again into details. Don't worry about the picture and this organization. All you should know is that liver has several different types of cells, but they can be divided into two big groups. One is the hepatocytes, or what's called as the parenchymal cells. Each organ in the body has parenchymal and non-parenchymal cells. What is the parenchymal cells? They are the cells that do most of the functions of the body, of that organ. For example, the parenchymal cells in your brain are neurons. Okay, they do all the actual function, and non-parenchymal cells are there to support the parenchymal cells and help them function. In the liver, hepatocytes are the parenchymal cells. They're about 60 to 70%. And then there are several different small cells that are called as non-parenchymal cells that make up about 40%, 35 to 40% of the liver, and they support the hepatocyte function. Okay, so one more cool thing about the liver I just want to mention for some geeks here who might be interested in it. All our organs in the body are made up of cells, right? And you might have heard that cells have two parts. This, it has, of course, it has the cell membrane, it has the cytoplasm, and it has the nucleus, right? In the nucleus is where DNA stays. DNA is our basic fundamental information database. That's where all our genetic information is stored in those sequences. This DNA is very important because in normal cells, almost all the normal cells, except the germ cells, cells in the sperm or in the egg, all the normal cells are what's called as 2N. Why 2N? Because they have two copies of each of your genes. Whatever genes you have, they have two copies of them. That's what they call as 2N. All cells in the body, except your germ cells, are 2N. However, not in the liver. In the liver, there is a significant difference in the ploidy, or the number of genes that each cell get. It turns out that liver cells are about 60% 4N. That means they actually have 4 copies of each gene. Why? We really don't know, but that's true. About 6% of cells have anywhere from 8 to 64 copies of a gene. It sounds weird, but it's true that each of the genes is not only in 2 copies, but anywhere from 8 to 64 in about 6% of the cells, and about 35% of the cells are normal 2N cells. Another very common thing in the liver is that they have binucleated cells. So normally when you think about a cell, you think about cell membrane, cytoplasm, and one nucleus where the DNA stays, right? Well, not in the liver. In the liver, as you can see in pictures below here, there are lots of cells that are binucleated. That means they actually have 2 different nuclei. And this is why, some of them have 4N, some of them have 8N. This is very common. In this picture, you can see 1, 2, 3, 4 binucleated cells. This is another one, 1, 2 binucleated cell, even third binucleated cell here. So this is a very unique thing, and people don't know what goes on. Now, one of the major features of cancers of any kind, generally, is that this ploidy in normal cells is messed up. Cancer cells have ploidy like liver cells. Cancer cells have 4N, 8N ploidy. But in case of liver, normal cells have ploidy like that. In fact, an experiment done showed that if you push cells to become all of them 2N, liver gets cancer. So the mechanism that prevents cancer in other cell organs actually can cause cancer in the liver. And that's why liver is kind of a unique organ when it comes to how it functions. Okay, let's talk about liver regeneration. This is something that I'm super excited about. This is what I study, and I have been wondering about it for a long time. Liver is pretty much the only organ in the body, only visceral organ in the body, I would say, which has this tremendous capacity to regenerate. You can take a mouse liver or a human liver and cut it up to 70% of it away. If you take 70% of the liver away, the remaining 30% liver in about 2 weeks in mouse or in about 3 months in human will grow back to its normal size where it started from. Okay, so liver has this ability to regenerate itself. There is actual cell division and adding new cells inside. This, apparently was known to the ancient Greek people, because there is this mythological Greek story of Prometheus. Prometheus was a titan, sort of a demigod, and he stole fire from the gods and gave it to the humans. And so gods got angry and they went to the king of the gods and said, his name was Zeus, and said, hey, you got to punish this guy. You can't, just steal things and give to people. And he said, okay, well, I'm going to give him punishment that nobody will, will have before. And so he condemned him to what's called as eternal torture. So what he did, and this is depicted here in this picture, this is your Prometheus. He tied Prometheus up to this pole on Mount Atlas and opened his belly and asked the eagle to eat its liver. And so the eagle would eat its liver during the day, and the night the liver will regenerate. And the eagle will come next day and eat its liver again. And thus Prometheus was condemned to eternal torture. And if you just look for Prometheus pictures on Google, you'll find hundreds of different versions of this. A lot of good painters, like including Michelangelo and others, have painted this. And each liver regeneration expert has their own version that they like. This picture here is something of a much later stage, in the sense that while we knew that previously people knew about liver regeneration, controlled scientific experiments started recently in about last 100 years. This is the first paper that showed how the liver regenerates in rats. And they did a study in rats, and they showed that liver, if you cut the liver out, the remaining liver will grow in about 1 or 2 weeks in case of mice. And we've been studying that for a long time. And this circular diagram sort of tells you how complicated this process is. Remember that liver does all these very important functions in the body. And so if you don't have a functional liver, life cannot exist. And because of that, regeneration has become an important coping up mechanism for liver. Liver is getting exposed to a lot of chemicals and bacteria, a lot of other abuse, and a lot of cells are dying. But that doesn't mean liver will fail, because it has this ability to regenerate itself, right? And so the mechanisms that drive this very important process is highly, highly complicated. In fact, there are many multiple redundant mechanisms, one after other, that can take care of it. So if one mechanism fails, something else will take care of the process of regeneration. Does it matter? Yes, it absolutely matters. Here are some data from a study in 2005, which is one of my favorite studies. One of the major problems with the liver is overdose of chemicals can cause liver injury and induce failure. Now, you all have, I'm pretty certain, taken a drug called paracetamol, medicine called paracetamol, which is a very common, probably the most used in the world, common medicine for fevers and pains. In the Western world here, we call it acetaminophen. In the Eastern world and Europe, it's called paracetamol. It's the same chemical. Normally, when you take paracetamol, it is fine as prescribed in the doses that you're supposed to take. But overdose of paracetamol leads to what's called as acute liver failure. Now, these doctors looked at patients who had overdosed on paracetamol, and they followed them over a 10-day period after these patients were admitted to the hospital. And they measured something called as alpha-fetoprotein. This is a marker that you can measure in the blood. It's a protein that you measure in the blood, and it is an indicator that liver is regenerating. Okay. And so what you see here is that overwhelming number of people that survived had an induction or increase in serum levels of alpha-fetoprotein. That means their liver was regenerating. People who died very rarely showed any sign of induction of alpha-fetoprotein. And so this has been studied extensively by our lab and others, and we now know that regeneration after acute liver failure is a critical component and is required for survival. This is also true with viral hepatitis and others. The other place where regeneration is very important is transplant. You all probably heard about liver transplant. It's an important therapy. A lot of diseases in the liver, unfortunately, are detected very late. They're detected late because of this liver's ability to compensate for its loss, right? So unless almost all the liver is failed, your liver disease is not generally even detected. Sometimes it is detected because you went to the doctor for something totally different, and then you find out, oh, you have a liver disease. But in other cases, you go to the doctor only when almost 90% of your liver has failed. And so liver transplant has become an important therapy for such people. Okay, transplantation has a long history here. This is just showing milestones. In 1950s, a lot of research started on this as a therapy. A guy named Thomas Starzl in University of Pittsburgh, where I had spent some time, actually in 1967 did the first liver transplant that was successful, after which a lot of research went on. Majority of these transplants from between 1970s to early 90s were done, and still today are done, using livers that come from people who have suddenly died. That's called as cadaverial transplant. Somebody gets into an accident, you get their liver and put it into a donor that requires. In mid-90s, Russell Strong and others, they started what's called as a living donor liver transplant, LDLT. That means you have a next of kin who's ready to give you liver or a match, and you take part of their liver and put it into the recipient. In both these cases, liver regeneration is extremely, extremely important, because the liver you put into the recipient is smaller and will actually grow in there. In the living donor liver transplant, you're taken a part of their good liver and the remaining liver will grow. And this is the graph, shows that. This is the liver tissue in grams here. And this is pre-donation liver. This is living donor liver transplant. The gray bars here, boxes here are donor liver, and the open ones are recipient. And you can see they essentially had almost the same amount of liver at the beginning. Then after donation, that means after liver transplantation, of course, their liver size went down, because you took out the liver from this and put a small liver in there. And you, of course, took a piece out of the normal liver. And then 3 months later, you see what happens. They're going back. The liver is growing back. And in about 6 months, they're both going to have the same amount of liver. So regeneration of liver is essential for your liver transplant to work. If liver didn't regenerate, you couldn't possibly transplant it. All right, let's spend last few minutes talking about liver diseases, because this is the health-related session. There are a lot of different diseases of the liver. I'm not going to list them all. This list by no means is comprehensive, but I'm mentioning some major liver diseases in the world, and we'll talk about a few important ones. Viral hepatitis remains the top liver disease in the world, followed by steatohepatitis, which is linked to liver cancer. There are diseases of the bile duct and the gallbladder, which are called as biliary diseases. They're very important. Then there is acute liver failure, things that I study, for example, chemical overdose, viral overdose. And then there is a very important component of drug-induced liver injury. We'll talk a little bit about that. And there are several genetic diseases. People have mutations because of which their liver doesn't function. Okay, so viral hepatitis. I know this slide looks a little bit more made for children, but I purposefully picked it because it's very nicely done. Hepatitis means inflammation of the liver. Hepatos means, or hepatar means liver. Itis means inflammation. Inflammation of the liver is induced by viruses, and there are 5 of them: hepatitis A, B, C, D, and E. Each of these viruses have a unique feature. In India, we commonly hear about jaundice, kavil, and that is essentially infection of hepatitis A. Hepatitis A happens through orophycal routes. That means people get contaminated food, contaminated water, which has fecal matter in it, and that essentially has hepatitis A virus, and you get infection. This is no long-term damage, no permanent damage. You essentially are sick about 6 weeks, and then you recover. And the symptoms are very classic, jaundice, malaise, fever, diarrhea, things like that. Jaundice is a common symptom in liver disease. It's not the liver disease itself. The root cause can be anything, but it can cause jaundice, okay? Hepatitis B and C are a lot more serious. These hepatitis B and C are essentially blood transfusion or through sexual contact, and they essentially cause liver cancer and liver cirrhosis. Of course, these are both chronic liver diseases. After infection, several years, couple of decades have to pass sometimes for the person to get actual liver cancer due to them or liver cirrhosis, but they're known to cause that. Fortunately, for both of them, now we have medicines. There is actually a very nice vaccine, and I encourage everybody to take it. Hepatitis B vaccine out there. It works fantastic, has no side effects. It will prevent a major life-threatening disease in you. Hepatitis C, we don't have a vaccine yet, but we do have some excellent medications now. Until about 5 years ago, we did not, about 10 years ago now, we did not have anything for hepatitis C. Barely anything worked. But the new medications, mainly from Gilead and AbbVie, are now, they completely cure you of hepatitis. Now, hepatitis D is a very interesting vaccine. Can only be infected if you already have hepatitis B. So if you have Hep B, you can get Hep D. And in that case, it is extremely bad. So normally you just don't get Hep D, but if you have Hep B, your chances of Hep D are very high. And then you can see the transmission is very similar because of the way these viruses work. Again, Hep D can cause the same symptoms. And hepatitis E, again, is very similar to hepatitis A. However, there is very higher risk of fulminant hepatic failure. This one is actually a lot more problematic because it actually affects women in pregnancy. And this is a major problem in India, where hepatitis during pregnancy is causing childbirth problems, death of the women, death of the children, and so on. So it's a major issue. What is the other two diseases that I want to talk about? Well, the other diseases kind of follow a similar pattern of progression. You have a healthy liver, and then you get something that is bad. That's the bad of the liver, and that leads to ugly of the liver. The liver disease follow this progression. They get fatty liver, then fatty liver becomes fibrotic, cirrhotic, and in the end, you can get liver cancer or hepatocellular carcinoma. In a lot of cases, liver cirrhosis doesn't even go to cancer. The liver simply fails. It doesn't function anymore, and it fails. Okay, this is a common feature of a lot of liver diseases. One of the major ones that everybody thinks about right away after they think about liver is alcohol, right? The public perception about liver disease is that it's caused by alcohol. And alcoholic liver disease remains a major problem in the world. There is no country in the world that doesn't have this problem. Unfortunately, no culture, human culture, is devoid of alcohol. And so this is always a problem. Remember, alcoholic liver disease is caused by chronic excess consumption of alcohol. These patients are drinking several melts of alcohol every day over a period of 20 years. So an occasional drink here and there is not going to cause alcoholic liver disease. I just want to make sure people understand that. But a chronic consumption, daily chronic consumption over a long period of time will cause alcoholic liver disease. There are some newer studies showing that any amount of alcohol is bad, but they need to be repeated, and we'll see what happens. And alcoholic liver disease, again, follows the same thing. First, liver gets fat, then it gets fat plus inflammation, then the hepatocytes stop functioning, so you get fibrosis, leading to larger nodules called cirrhosis, and then you can get cancer. There is pretty much no therapy in these last two stages. You have to get liver transplant. But if you have early alcoholic hepatitis and you stop drinking, you can actually reverse the disease. A much more severe and much more tricky problem has arose. During mid-90s, late 80s, mid-90s, a lot of liver doctors started seeing patients that their livers look exactly like alcoholic liver disease, nothing different. And these patients claimed, and their loved ones claimed, that the patient has never drunk any alcohol, doesn't drink alcohol at all, but their liver looks like alcoholic liver disease. And so a new disease came on the stage, which is now called non-alcoholic fatty liver disease or non-alcoholic steatohepatitis. The common factor in these patients is overnutrition. Overwhelming majority of these patients eat too much. They have type 2 diabetes, metabolic syndrome. They have absolutely no exercise. They're obese, they're big. And all of that has led to their liver. So it turns out that overnutrition, eating too much, eating bad calories, too much sugar, having type 2 diabetes because of that, and having less exercise leading to a fatty liver can cause a very similar thing called as non-alcoholic fatty liver disease. Again, goes through the same kind of stages. You get steatosis. In this case, it's called NASH. In case of alcoholic, it's called ASH. There's cirrhosis, and then you get liver cancer and liver failure. This has become the #1 liver disease in the world, and we have absolutely no medicine for it. If you get it, it's almost always a death sentence, especially once NASH is established. There is very little people can do. It's wait and watch. After that, liver is slowly going to fail, or next decade or less than that. And that's why it's very important. Daily exercise and watch what you eat is extremely important for your liver health. India is going to be a hotspot of NASH. India is going to be the world capital of type 2 diabetes. NASH is associated with that. And so this is growing like anything. Now, you will remember, people who are on this call and are in the Western world know, probably seen really big people, obese people. We don't see that kind of obesity in Eastern world. Most Southeast Asian people are not as big as some of these Western counterparts. However, it turns out that there is a disease called as lean NASH, and it is even worse. Most people in India who are getting a lean NASH. These people you will notice that they're not obese. They're overweight, but they're not obese. They're not like, huge, but they do have slightly higher body BMI, body mass index. And it turns out that the biology of this is slightly different, and people are trying to figure out, this is how it looks. You have a lean, normal human being, and then you, of course, have an obese human being, which has a lot of weight, huge BMI, peripheral adiposity, cardiovascular mortality is higher, all of that. These are obese individuals. But the lean NASH are classic Indian phenotype, I would say. They're slightly higher visceral adiposity. They have impaired glucose tolerance. They have several cardiovascular problems, and they get NASH. And again, this is something becoming a major problem in the not only in India, but almost entire Southeast Asia. And then there is a disease. There is a component of the disease that we are trying to figure out, and this is called as TASH, toxicant-associated steatohepatitis. That means in the sense, I'm a toxicologist by training. That means I have studied how chemicals affect the living system. And we think that there are chemicals that can actually cause or exacerbate existing disease. For example, chemicals called as PCBs, polychlorinated biphenyls, which Kshitij here is going to get very familiar with very soon. They essentially block normal function of the liver and induce toxicant-associated steatohepatitis. Same thing happens with several other chemicals like perfluorinated compound. And we are worried about this because this is very, very poorly studied, and we need to understand what's going on there. Last couple of slides, just wanted to show you that non-alcoholic steatohepatitis is a major issue. This is total liver cancer incidences. You see, India isn't a hotspot of liver cancer. But if you look at NASH plus liver cancer, India is a hotspot. So, in the world, there are too many. There are few countries that have significant NASH problems, and NASH has become a major problem. In the end, I want to end with this little thing about chemicals causing liver injury. There are a lot of different chemicals groups that cause injury. We talked about some environmental chemicals like aflatoxins and perfluorinated compounds. There are some of your normal medicines that can sometimes cause liver injury. People who take statins for lowering their cholesterol should be careful about. Some people who get autoimmune disease, they get drugs like methotrexate, and they can cause liver injury. And a major cause of liver injury in India and Indian subcontinent and Southeast Asia is anti-TB drugs. It turns out that about 10% of anti-tubercular drug-treated patients will get massive liver injury, and it will have to be dealt with. And then there is this whole concept of herbal supplements, which is highly controversial, and it's actually very important. A lot of people who are taking herbal medicines, medicines that are not really formulated, they will end up getting a liver injury. And a classic example is green tea extract. And then we also have to talk about drugs and medicines, chemicals and drugs, as well as herbal supplements and drugs interacting with each other that can cause injury. The basic concept one has to remember is that it's all about the dose. The basic principle of toxicology is simple. We think everything isn't poison, only the dose determines if something is poison or not, right? So every chemical in the world at certain dose will become poisonous. So you have to kind of put that in the context. And this website here shows you, it's called the Liver Talks website. It will give you a lot of information about liver injury in the world. And so, I just wanted to post this data here from our data set, and shows India and China and Southeast Asia as a hotspots, including United States as a hotspots of liver disease. Most of it is NASH. So just to summarize, liver is an important organ. It does a lot of exclusive functions that nobody else in the body can do, and it is remarkable because it has this amazing capacity to regenerate, and liver diseases are highly prevalent. And I want to end by thanking JPF and iBRETA and Kshitij for giving me an opportunity to talk to you guys. Thank you.
Thank you, Dr. Apte, for this insightful session. I remember when we first met Dr. Apte, he said that now we live in this world or sea of chemicals, and we don't have an option but to adjust to this life. And I think in today's session, he has told us what chemicals are there, how our body deals with them, especially liver, and what we can do to take care of it, and how our lifestyles could actually improve the situation. So we had asked participants to put up their questions beforehand as well, and we have a few questions. So I'll ask some of them, and then we can open this discussion to everybody, so that if someone has any extra additional questions, they are free to chat. So you were talking about some of the liver diseases which are inherited, and some of them are acquired because of different factors. So somebody was asking about what about Gilbert syndrome, which is one of the inherited disease, and then if you can also touch upon other genetic factors. One, can they be diagnosed in earlier stages, and if so, do we have any things to tackle them?
Sure. So yeah, there are several genetic factors that affect liver. Gilbert syndrome, if I'm not wrong, and I'm not a doctor, so don't
Mm,
quote me on that. I'm a basic scientist, but it is where you have this increased bilirubin when everything else is normal. It's generally considered a benign condition. There is a lot of there are a lot of these things where you have mutations in genes that affect. There are a lot of examples of that. Some of them are life-threatening. For example, glycogen storage disorders. There are children. Almost all the genetic liver diseases are pediatric because liver is such an important organ. These diseases manifest them when the baby is born right away. And so there is something called as phenylketonuria, glycogen storage disorders, where you have problems with genes that are metabolizing some of the pathways that I showed, and because of that, liver has injury. There is familial tyrosinemia, where these patients cannot metabolize tyrosine, and so they get liver injury. There are diseases that cause cysts in the liver. These are fluid-filled pouches in the liver, and they cause liver injury. These are polycystic liver diseases. So yes, there are these, and one can easily find them out. What happens is most cases, nobody is going to go look for them beforehand. Of course, if the patient comes become symptomatic, as they call it, and then a doctor looks at them and then they order some tests, you can easily do a genetic test to find out. So the tests exist, and one can find out. Of course, you can always do something like a genetic screen before in you and your partner to see if, when you are going to have a child, whether they will have any predisposition or not. That is also not uncommon, especially in the Western world. But generally, these diseases are detected later once the symptoms are there.
Right, because you said most of the liver diseases you do not detect them in earlier
Right.
stages, but since it's a genetic factor, does it still affect like children at young age as well?
Yeah,
I mean,
most genetic diseases are actually detected right after birth,
okay,
because they will manifest them. There are a few that takes long period of time, but mostly not. They generally will have right
right.
away. Yeah.
And second part, like since it's again inherited, so do parents also show symptoms? Maybe not earlier stage, but at later
Right. In
stages?
certain cases, they do. Certain cases, you know how genetics works. You might have a recessive and dominant copies, and depending on
Mhm.
what your genetics is, sometimes you are a carrier and you don't
Right.
know that. So it just
Okay.
depends on how it is.
Right. Okay. Thank you. And then you talked about multiple factors
Mhm.
which affect liver health. And then you said whatever you eat, whether good or bad, it's going to go to the liver. So there were like a few questions about how liver functioning is affected by some natural remedies that you touched upon, like aloe vera and green tea, which are either true or not. We don't know it yet. Maybe.
Right, right. So what happens is a lot of these, the two components that one need to understand. One is the dose. A lot of natural remedies or natural supplements, dietary supplements, HDS is what's called herbal and dietary supplements. They are a mixture, right? They are not a single component. They are either a tea or a concoction or something, and they contain multiple different chemicals in them, and these chemicals when they come together can cause injury. The other component to remember is the dose. It really depends on how much you get it. So it is, if you get it up to a certain level, the body can handle it, but after in a certain level it starts becoming toxic. And so that is a very important concept to remember in herbal supplements, that the idea in general we have is that herbal supplements or anything like that are generally very safe and they have no side effects. It's absolutely not true. In fact, they have significant side effects if you reach certain dose, and we don't know about those side effects. The third problem with them is their interaction with normal pharmaceutical agents. A lot of these chemicals, they will actually change enzymes in the liver by mechanisms that are actually quite well known. When these enzymes are changed, your normal pharmaceutical agents, normal medicines, they require certain enzymes for their own function. If these enzymes are changed by herbal supplements, then your pharmaceuticals won't work. I'll give a very drug-drug interaction is a very interesting topic, and it's a bit off topic, but I'll give an example. Um, the which is a kind of an extreme example, but it's a real example. The oral contraceptive pills, which are very important for reproductive health, they require your liver to have certain enzymes for function. Now, lots of different herbal supplements. There's one called a St. John's wort, which is very, very common in Western world. It induces that enzyme. So when that enzyme is induced, the oral contraceptives that the person's taking, they are metabolized much faster before they can have any effect. And because of this, a lot of people end up having unwanted pregnancy. So this is a classic example of drug-drug interaction. This happens in the case of liver as well. A lot of times green tea extracts will cause injury on themselves, but because they induce a lot of other things in the liver. And this needs to be, it's not always clear and needs to be looked at.
Right, yeah. I think like similar to this, there were questions which you also touched upon, that different medicines, how you take them and how much you take them
Mhm.
affect. And medicines which are meant for curing one type of disease affect your other body part.
Mhm.
So people were wondering, like, if someone has diabetes and they have to take certain medication, and then what can you do, or are there any, I don't know, supplementary medications which would
No, so
balance it?
what I would say is that if your medicine is prescribed by a doctor, most of the modern medicines, they are studied extensively for their side effects before
Mhm.
they are released in market. There is tremendous amount of data available, and because of that, the side effects are well known. For example, if you're taking statins to reduce your cholesterol, which is a common medication now, I take it too. One of the problem with that is muscle pain. In about 1% of people, statins will actually cause liver injury, and we don't know the mechanism of it. So when doctors are prescribing it, what they're supposed to do is ask the patient to follow certain signs. So you started suppose taking statins. When they start, they're supposed to do a blood test to make sure your liver is normal. And then every 3 months, you're supposed to do a blood test to make sure you're not getting any statin related liver injury. And so, the statins work. There is no question about it. They work absolutely well. You just have to make sure they're safe. And so I would kind of talk to the doctors and ask specifically, are there going to be any side effects? How do I know there are side effects? What are they? How, what can we do to
Right.
reduce
So
that?
one thing we can definitely do is, if we are taking medication for one thing, we should also let the doctor know that if you have other issues,
Absolutely. The doctor is
definitely
supposed to
not like
ask you what
hide
else
them.
is going on.
Yeah,
Absolutely.
right. Yeah. And then you also touched upon a few things like you need daily exercise or proper diet. So regarding diet, you mentioned about sugar intake. Are there any other nutrients which, let's say, taken in higher amounts specifically affect liver
Oh,
functioning?
yes. Oh, yes. So hypernutrition is a huge problem.
Mhm.
High amount of sugar, especially fructose, corn syrup-based fructose, which is used in our cold drinks, Coca-Cola, Diet, Pepsi, whatever you have, all of them, they are sweetened using this corn syrup. That is the major problem. And high fat diet. So what it's essentially called is a Western diet is a bad idea, in the sense, too much fat, too much cholesterol, and too much carbohydrates. Is a combination of that is a really really bad idea. And it's okay to go and enjoy that burger or sandwich or whatever with a Coca-Cola once in a while. But if that is your diet, mainly your diet every couple of days, that's a bad idea. I think that will definitely lead to a problem. Even if you're doing exercise, it's a bad idea. It turns out that what we call as high fructose, high fat, high cholesterol diet is bad even if you have exercise. It just, you need to eat better. And again, if you don't have daily exercise, that is going to cause this hypernutrition to get even worse.
Right,
So avoiding all of that and exercising daily is absolutely essential for your liver health.
right. And what about like micronutrients that we take in?
Yeah, most people take some sort of supplements, some sort of vitamins, and
Mhm.
mostly again it comes out to be the dose. If you take them at the dose that is prescribed, you're going to be fine. They're
Okay.
actually required. In the Western world, we see a major issue with vitamin E deficiency because the
Mhm.
sunlight is significantly less. We don't see it in India as much because there is no lack of sunlight. In the Western world, we are indoors a lot, and there is relatively less sunlight. So a lot of people suffer with vitamin E. So we take vitamin E supplements, things like that are important, and you have to take them. Vitaminosis is a thing. Too much vitamins is also
Mhm.
bad. So just don't keep pouring yourself, because there are two things. One, certain vitamins in too much quantity are bad, and then almost all the vitamins you're taking, you're just throwing them out of your body without using them anyway. So you have to be very
Right.
careful about what you do there.
Yeah. And nowadays there is like a alternative for sugars, which are like artificial sweeteners.
Yeah,
Are they better
yeah.
than this for
That's
liver?
a yeah, that's a very good question. There is a lot of this that is being that is being out there, what is being used. And the jury is a bit out of them in the sense that Food and Drug Administration, FDA here, of course, has approved them. There are significant number of studies showing that they're absolutely safe. But once in a while, we get studies saying they have certain side effects. I personally have chosen the path where I don't have any sugar supplement. I don't take sugar in my tea, coffee, or anything. I don't add Splenda or anything. I'm just like, okay, I'll train myself not to, eat or drink sweet. However, a lot of people cannot do that. My father-in-law, for example, is type 2 diabetic, and he takes Splenda in everything he does, and it seems to be safe. So again, it comes probably to the dose, but they seem to be okay. For now, we don't have to worry too much about them.
Right. And about the fatty liver diseases that you talked about, which are either alcoholic or non-alcoholic. So you mentioned that there are stages by which like liver goes more and more worse condition. Is there any stage after which it can be reversed because of medications or some other things?
Right. So in case of these fatty liver diseases, both alcoholic and non-alcoholic, the stage that is considered still reversible is when there is steatosis. That means fat stuck in the liver, which is the first stage. If you stop eating bad and start exercising, you will reverse and you'll get better. If you stop drinking, you will get better. Once the inflammation starts, that's where the component of irreversibility comes in. We call it point of no return. And then, you're slowly creeping towards point of no return. The major issue is once the hepatic fibrosis is set, that means normal liver cells die and you get fibrous tissue like a wound, a scar tissue in there. That's when, you are closer to a point of no return. After that, there's no real medication. It's going to progress. And so finding it out early and, most doctors don't think steatosis is a problem. They say it's not a big deal. Generally, people who exercise and eat better, they will reverse it. But once you get steatohepatitis, that's where concern comes in.
Right. Yeah. And this is just out of my curiosity. Maybe you are talking about liver regeneration, and then does it depend on like which zone that you are talking about? Since zone 2 cells are more important for regeneration, so does it depend on which part of liver is transplanted or which part is cut?
Yeah. There is some thinking about certain parts of the liver are better to transplant, but it doesn't matter. In the end, no matter which part of the liver you transplant, you get some sort of liver regeneration. It turns out right liver lobe is bigger, and transplanting that has slightly better outcomes than the left liver lobe. But left liver lobe works as well. Entire liver has ability. All hepatocytes have equal ability to proliferate and be able to replace. So the ability of liver to regenerate is very sort of homogeneous.
Right. So thank you. And then we have a few questions. So Vedang, if you want to unmute yourself and ask the question yourself. Vedang, if you're talking, you are still mute.
I read his question. So he's talking about diagnostic tests. Normally what needs to be done, and is something that we don't do as often in India, I think, is that it is a good idea to get blood work done every about once a year for sure. And your standard blood work that your doctor orders has these tests called as a liver function test. There are 4 or 5 different things. There are 2 things that they measure to see if your liver has any structural damage. That means if cells in the liver are dying. They include ALT, AST. People in India call it HGOT, HGPT, same enzyme. And then there is GGT for biliary cells. And then these are structural damage markers. There is also bilirubin, and we have another question about it. There is also bilirubin, which is a component of blood that is excreted via the liver, and removing bilirubin out of the body is one of the liver's functions. And so our bilirubin should be, somewhere around 1 every, 1.1 is what they do, I think. Making sure that is a marker of liver function. That means if liver is functioning well or not. Sometimes you don't have any structural damage, but there is no function. And so you get something like that as well. And so those are done. There's another thing, people measure blood urea nitrogen, people measure serum albumin. So this test is standard. Every pathology lab can do it. And it's a good idea every year to ask your doctor to order that test and get it checked, just to make sure that everything is going well, especially after the age of 25, 30, you start kind of matching it. And you should do it at any age. It's not something. Which test would you prescribe for urban Indian diet and lifestyle? There's nothing like that, right? First of all, I'm not a doctor, so I cannot give you any medical advice. But there is really no such test. Use common sense, right? You have to eat healthy. As I said, high fat, high fructose, high cholesterol. Anything that has that is bad. That's one thing. And second, dose determines the poison. If you have something like that once in a month, that's not going to cause fatty liver disease. If you have that every week, maybe there is a chance. If you're doing that 3 times a week, yeah, you're in trouble. So that's one, just kind of be, cognizant of that. And secondly, exercise. I think it turns out that daily exercise makes a major difference in liver health. It's important that you differentiate between exercise and exhaustion. You come home, you've traveled a lot from one place to be other for work or for education or whatnot, and you think that I've been exhausted, and that's not exercise. You just have to provide yourself time for exercise, which is different. So those are the things that are important, I think. We did talk about Gilbert syndrome, Vineet. I think it is sort of a harmless liver condition in the sense that, in fact, I also have sometimes that. It turns out that I'm not, my bilirubin is always slightly higher. 1.3, 1.4. And I used to be very concerned about that. And when we did some work on it and we figured that I might have that, it is because there is an enzyme in the body that does not convert your reactive bilirubin, correctly as the way it should. And that's why you're slightly higher. If that is the only thing that is higher, but everything else is normal and you're healthy, generally, they ignore it. One can do a genetic test. You can go and get a genetic test done to confirm that you have Gilbert syndrome, because the mutation that causes Gilbert syndrome is low. But generally, it's a harmless condition. But you should definitely talk to your doctor and say, hey, why do I have this? Do I have Gilbert syndrome? How do I confirm it? And once it's confirmed, I think you should ignore it, because it's considered a benign condition.
Okay. So you can make changes in your lifestyle or eating habits so that you don't have too much bilirubin.
No, it's not so much that. It's in case of Gilbert syndrome, you're gonna, no matter what you do, you're gonna have higher bilirubin. But having that higher bilirubin doesn't mean that there is a liver disease.
Okay.
Normally these patients always have higher bilirubin, but it is not sign of liver disease. However, that needs to be confirmed by a doctor. Don't take my word for it. Definitely get it checked and make sure that it is Gilbert syndrome, and that increased bilirubin is not because of some sort of actual liver disease.
Right.
And there is a way to do that. You can actually go and get a genetic test to make sure that the mutation exists, and that's why you have it.
Right. Yeah. And
there's something about herbal medicine, something. Is there any herbal medicine which helps in liver cell regenerating? We don't know. I've been looking. A lot of people claim that. There are a lot of papers which will say stuff like that, and you go and look at the data, and it's not really proven well. I will be surprised if there is not something like that out there, especially, in Ayurvedic medicine. I've tried to talk to some experts and see if they can come up with some candidates to look for it. The problem in testing some of these things, as you know, with especially with Ayurvedic medicine, they are a concoction of many different things, and it's hard to test them because every time you make that medicine, the relative amounts of stuff in that particular concoction can change. Also, if I make the concoction versus you make it, even if you use sort of the standard procedure, you might get completely different levels of each of those things. You might have all of those things, but at completely different level. And so there is no standardization. And so it becomes very hard to test them, but one can look always.
Right. Maybe we'll take like last two questions. One thing was how smoking affects liver, since smoking basically would firstly affect your lungs, but lungs would take up the blood, as you mentioned, to liver. So
Oh, absolutely. There is a well-defined effect of smoking on the liver disease, existing liver disease, as well as liver condition, mainly on existing liver disease. When you smoke, you are inhaling hundreds of different chemicals. It turns out that normal standard smoke, and now there is an entirely new threat on the horizon, which is a major issue here. I don't know if it is in India or not. We call it. They call it vaping. This is not smoking exactly. They are nicotine vapes. Anyway, nicotine affects liver. There are a lot of different other things within cigarette smoke that affect. As you know, and we explained this in the slides here. When you breathe, you take in oxygen along with that smoke, I guess. Your deoxygenated blood will take up everything that comes up along with that oxygen. And that deoxygenated blood is going to go back to the liver, go through your gut, and end up in the liver. And liver has this function of getting rid of all these xenobiotics. So it ends up in the liver and it needs to be metabolized. So smoking is known to exacerbate existing liver disease. And so, of course, lung cancer is a major problem, but it will absolutely exacerbate ongoing liver disease.
And like last question. So our last session was on gut microbiome, and then Dr. Yogesh Chowdhury talked about how taking antibiotics when actually you don't have any bacterial infection is going to kill the good microbes in your system.
Yeah.
So I was wondering how those two systems are connected, like how gut microbiome helps in liver health.
Yeah, I'm thankful that you actually asked this question. One of the major components of an extra hepatic source that affects liver tremendously is the gut microbiome. In fact, there is an entire subfield in the liver disease area which looks at liver-gut axis, as we call it. As you see, blood comes from the heart, goes to the gut, and from the gut, it goes back to the liver. So everything from the gut will go directly to the liver. The things that are in the gut, including bacteria, they go to the liver too. Having healthy gut bacteria are extremely important for everything in the liver. If you have dysbiosis in the gut, that affects your liver disease. A lot of people have shown that changes in gut bacteria is a major component of non-alcoholic fatty liver disease. Changes in gut bacteria are a major component of alcoholic liver disease in a slightly different way. The gut, in the gut wall, the cells in the gut are tightly attached to each other. Alcohol reduces that tightness and creates what's called as a leaky gut. Because of the leaky gut, normally you don't see these bad bacteria coming into the liver or bacterial products that are bad that are coming into the liver. But in the alcoholic liver disease, that happens. You get leaky gut and you get seepage of stuff out of the gut and it reaches the liver. And then, you get liver exacerbation of liver disease. There are studies where people have shown that if you put good bacteria in the liver, in the gut, you improve liver health as well. So there is a lot going on. Another thing that is very important in this context is that, we talked about bile. Liver makes bile. The bile is secreted into gallbladder. When we eat, a hormone called as cholecystokinin goes back from the gut to the gallbladder wall and induces a squeeze into gallbladder. When gallbladder is a pouch, it's squeezed, all the bile flows out and comes to your duodenum, right where your stomach and duodenum ends. That's where it comes in, and it helps in emulsifying and digestion. Along with it, all the bile acids also come in, right? Then it flows down the food pipe, and in the lower intestine, it is taken up back by the blood and brought back to the liver. And this, what we call is enterohepatic circulation. Enterohepatic circulation. Enteros is gut, hepatos is liver. Enterohepatic circulation is extremely important for liver health. And if you have a problem in any of those two components, you will get liver disease, or you'll get progression of the liver disease. So that is another important component.
That was very interesting. Thank you. If there are no more questions, Shaili, do you want to take over?
Yes, thank you so much, Dr. Apte. It was a very insightful session. And I'm sure after listening to you talking about this, the biggest internal organ in our body will take care of the moods of our liver. With that, we have also a big announcement before we part ways. Let me see if I can do this. Yes, so we are inaugurating our training aspect of iBRETA on 13th of May with a series of talks about menstrual health. We have wonderful gynecologists associated with this talk. We have Dr. Girija Wagh and Dr. Vaishali Biniwale, who will be talking about the monthly hormonal circus that all females go through, the menstrual well-being and diet and hygiene, the menstrual disorders and their causes, diagnostics and preventions, and the menstrual products that we can all use. So make sure that you look forward to the details of this training session, which will begin from 13th May and will go until 4th of June. So check our socials on Instagram, Twitter, LinkedIn, and on Facebook. With that, I would like to thank Dr. Apte for a really great talk. I'd like to thank JPF for providing a platform to conduct such awareness sessions. Whole of our iBRETA team, our project planning committee, JPF's social media team, and JPF's website team. Thank you all of you for joining here today. And thank you everyone who's joined us here on YouTube today. If you have any further questions about this topic, we'll make sure that we get back to you with your questions. So make sure that you email us your questions at biomed@jnanaprabodhinifoundation.org, and we'll put this email in the chat for you to find. So thank you everyone for joining here today, and have a great day.
Thank you.